Reaching a healthier weight now can prevent health issues in the future. Cardiologist Dr. Eldad Einav is here with us tonight talking about the connection between obesity and heart health and what we can do to reach a healthier weight. Hi everyone, welcome to My Weight Live. We have a very special episode for you, but before we get started, let me know in the comments where you're watching from and tell me if it's your first time joining us. Dr. Einav, thanks so much for being here with us tonight.
Thank you for having me.
So you're a cardiologist and you're also board certified in cardiology and obesity medicine. Tell us why it was important for you to focus in both fields.
I see obesity care as part of preventive cardiology. I have tried losing weight myself. I know how difficult it is, even to lose 10 pounds, 20 pounds, and keep it off for a long time. This is absolutely a big challenge, and we know that. Obesity is an independent risk factor for cardiovascular disease, contributing to heart failure, to arrhythmia, like atrial fibrillation. This is all, the connection is very well established, and we know that.
So you were interested in obesity medicine as a way to help your patients lose weight. What can happen when someone reaches a healthier weight? Can that prevent future cardiovascular events?
So we do see that weight loss, especially if it is a significant weight loss, more than 10%, can prevent a cardiovascular outcome. So there were some clinical trials that looked at that, and you really need to have a significant weight reduction to achieve that. Some of the data is still coming from other clinical trials, but I would say it depends how you do it, right? If you do it with medication, there are certain medications that would be able to show or demonstrate some outcome benefit. Lifestyle program, it's hard. It was checked, but because lifestyle alone doesn't achieve a lot of weight loss, they didn't clearly demonstrate a benefit. And with bariatric surgery, we also can demonstrate a benefit of even in longevity. And so definitely I have no doubt that significant weight reduction will affect cardiovascular mortality and morbidity, meaning disease and longevity related to cardiovascular disease.
So there's probably people watching at home thinking to themselves, like, that's great that, reaching a healthier weight can improve my cardiovascular health, but I've tried so many times to lose weight and I've never been successful. And that's certainly something you observed with your patients as well. How can seeing someone like you enable someone to be successful over the long run?
I'm going to be honest with them, and I'm going to say, you've tried so many times with weight loss strategies before, and you didn't get to the point you want to be, right? And I also tell them to look around you. How many people you know that are obese and lost a lot of weight, significant amount of weight on their own and kept it for years without any significant medical intervention? And the answer is usually very few, if any, right? So we can't really ignore that. We have to show them the way they achieved the weight loss before is not sustainable. They can't keep it off. And people have a challenge in accepting that, in coming to terms with the fact that only working out and dieting is not enough. People are shocked sometimes, even well-educated people, when I tell them, it's not going to happen with lifestyle alone. Just diet, I'll put you on a diet, you'll see a dietitian every week, every day. You're going to walk more. You're going to be in a program. By itself, it's not going to give you the weight loss you're looking for. Yes, you can lose weight, but you will not be able to sustain it. The only way we know now that is supported with science to sustain weight loss long term is anti-obesity medications and bariatric surgery. This is, we could demonstrate a clear benefit which can be sustained long term. Lifestyle interventions are very important, but just having them without having any medical intervention would not get you where you want. Fortunately, now we have new classes of medications for obesity, and they show a long-term success, especially the ones that are safe and also have some data about long-term safety and cardiovascular safety. Some of them even show benefit. So as preventive measure, also for cardiac disease, definitely. Then we need to use all the help we can get to sustain weight loss.
So many more questions for you, Dr. Einav, but we are going to take a break and do our trivia question. Folks, if you answer tonight's question, you'll get a guide for speaking with your doctor about weight. It will walk you step by step through the process with tips on how to start the conversation, what to do ahead of time, and more. And you will get it for free if you answer tonight's trivia question, which is, true or false, having uncontrolled high blood pressure increases the risk of having a stroke? Is that true or false? Does having uncontrolled high blood pressure increase your risk of a stroke? Put your best guess in the comments and you will get that super helpful doctor's visit guide delivered to your Facebook Messenger inbox. So the good news is that losing 10 to 15% of our body weight through medical treatments can have a big impact on our health overall. Talk about some of the benefits of that kind of weight loss.
So on top of body image issues and just the aesthetic factor that people are initially looking for, the more important thing will be preventing heart attacks, stroke, and other cardiovascular disease, heart failure, some of the arrhythmias. Weight really has a lot of complications: liver, gastrointestinal system, could be musculoskeletal system, all of that. Think about the burden you have on your skeleton carrying excess weight of sometimes 100 pounds or more. So the benefits are huge. We all know that, but we also see the benefit only with certain procedures or certain interventions when it comes to cardiovascular disease.
So tell me how you go about working with the patients you see to develop a weight management plan that's right for them. Like if I see you, what are all the different things you're going to work with me on?
So first of all, the first appointment, I screen them for all their medical issues, including cardiovascular disease, family history. I send them to blood tests and I see all the risk factors, and I talk to them about the options they have to really achieve this long-term success, and once and for all, because we don't want them to fail again. And many times I have the discussion. The first discussion is talking about anti-obesity medications. We have a lot of resistance because people are misinformed about this. So one big thing is they really think they can do it by themselves. The reason, why are they seeing me? I'm asking them, how do you think you should lose the weight? You come to see me. And many of them say, oh, just give me some coaching, some education, show me how the right diet is. But when it comes to medications, say, no, I don't like medications. But so it's important to tell them the truth. It's important to tell them just using lifestyle modification, just changing the way you eat. And it doesn't matter, high carbs, low carbs, low fat, high fat, you name it, anything. I have nothing against any specific way to lose weight. You can lose weight on all of them, but the key should be, what can you sustain? And nothing, no lifestyle alone can make you get to that sustained weight loss. And understand, some patients see it as crutches, the help from a doctor, but you want to be healthy. You take medication for blood pressure, right? This is not a crutch. This is why we live longer and better with modern medicine, because this is technology. And it's not going to be an easy fix. You always have to bear in mind, you have this tendency to have extra weight. So yes, it's a chronic problem, but we do have now, and there are more in the pipeline, medications that can help you achieve that and sustain it over time. And if you think you can do it without the medication, you are wrong. You are wrong. It's very hard. It is not impossible, but next to impossible. And I want people to know there are studies that show that.
In case you're just joining us, we're here with Dr. Eldad Einav talking about the connection between weight and health. And we're giving away a wonderful guide to speaking with your doctor about weight if you answer tonight's trivia question, which is, true or false, having uncontrolled high blood pressure increases the risk of having a stroke. Is that true or false? Put your best guess in the comments, and you will get those tips for speaking with your doctor about weight delivered to your Facebook Messenger inbox. And folks, we do this show every month, and we want to make sure you never miss an episode. Text the word WATCH to 844-966-1957, and we'll send a short text message to you when we go live each month so you can join the conversation in the comments. So what should men in particular know about the connection between reaching a healthier weight and better heart health?
Men is a challenge too. A lot of them are not very concerned about weight, even if they have a lot of excess weight, right? But some of them are concerned about their heart health or the cardiovascular disease. And there's a lot of fears, drop dead. Doctor, I don't want to drop dead from a heart attack. But they were not going to see, oh, I need to shed 50 pounds for it. So I need to tell them the relationship with that. So the weight, how it contributes to the risk factor and the likelihood of having cardiovascular disease. And then would tell them how to achieve it and show them that I can achieve that with a medication that can prevent heart attack and stroke.
So if someone has already had a cardiovascular event, like a heart attack or stroke, can reaching a healthier weight now kind of prevent a second event from occurring?
Well, the specific question you're asking, we don't have a clinical trial that are specifically designed to answer, but if you are if you're controlling your risk factors, including your weight, it is very important, especially for people who have the disease, right? So because your risk of having another stroke or another heart attack is way higher than the general population that didn't, or patients that did not have it, right? So the importance of risk reduction and weight reduction is much higher in your case. And I take this opportunity when someone has a heart attack and stroke. It's an opportunity, right? Let's discuss how you really control this blood pressure. Let's talk how we discuss this weight once and for all. So let's start the discussion about how you really do it. And we do have a way.
So what are those things that are backed up with data and science? You said if you want to lose weight and keep it off, I have a way. What is that way?
Well, the way is to take anti-obesity medications or have bariatric surgery for weight loss and combine that with lifestyle intervention. So lifestyle intervention is very important, it's key, but if associated with the right medical intervention, right? We're not talking about 10 pounds here and there just to fit into a dress, right? We're talking about people with excess weight that really increases the risk for heart attack, stroke, and multiple system disease, right? Sometimes we talk about even up to 14 years that you're going to live less because of excess weight and the other risk factors associated with it. So that's a lot of years. And don't you want to have this extra years? I tell those patients, don't you want to have better quality of life, less disease, and more years to live? I mean, and I give you a way that is proven, right?
Dr. Einav, I ask this of every physician we speak to. What is the number one thing you wish people knew about weight loss?
The number one thing that I want my patients to know is they cannot really likely to achieve their goal on their own. And it's not their fault. And it's not because of the diet they had. It's not because of the macronutrient content they have. It's not because they didn't really go to the gym or not. It's not because they have a bad knee. No, it's not the reason. The reason, there is no way, it's next to impossible to lose a lot of weight and keep it off over time. And the only thing that is effective is proven medical interventions, namely medications or surgery. Seek a consultation by an obesity care specialist, because we do have specialized skills, we do have the knowledge, and we can really help you with the options, right? And we can also tell you a lot of truths, a lot of a realistic and more successful approach to weight loss.
Thank you so much for joining us tonight, Dr. Einav. This has been an absolute pleasure.
Thank you.
And a big thank you to everyone watching at home. We're so glad you're here with us tonight. Before we go, here's the answer to tonight's trivia question. True or false, having uncontrolled high blood pressure increases the risk of having a stroke? The answer is true. If you didn't get to answer the trivia question, but you'd still like that guide to speaking with your doctor, just leave a comment for us and tell us what you thought of tonight's show. And we'd like to thank Novo Nordisk for their support of this program. Novo Nordisk is not responsible for the content of this show, nor have they influenced it in any way. I'd like to encourage you to visit truthaboutweight.com to learn more about the science of weight loss. We will be back with a new episode in a few weeks. Until then, please stay safe and take good care. Good night.